For years, Terry Jo Myers suffered with symptoms related to interstitial cystitis, a painful bladder and pelvic condition that can disrupt a patient's entire life.
When it started at the age of 21, I may have only gone to the bathroom 4, 5, 6 times during the night. But by the time I was competing on the LPGA Tour, it was nothing to be going to the bathroom 20 times a night, depending on how serious it was.
Interstitial cystitis, or IC, can make every day a struggle.
IC is potentially devastating to a patient's life. It affects all walks of somebody's life. It can affect their performance at the workplace. It affects their relationships. Many patients with interstitial cystitis live with terrible pelvic pain.
At first, Terry Jo was unsure of what was causing her symptoms. Then, she began to suspect she had a urinary tract infection, or UTI.
I thought I had a UTI, somewhat severe one, but I had the urgency and frequency, some pain and pressure in the pelvic area. And the urgency wasn't such that I felt like, gosh, I need to get to a bathroom. It was more that if I don't get to a bathroom, it would feel like the pain and pressure would intensify.
So how many trips to the bathroom would you say you're 15? The symptoms of IC are basically threefold. Severe urinary frequency, up to 20 or 30 voids per day, waking up several times at night. Severe urinary urgency, so that even after they voided, they still feel a need to go to the bathroom. And finally, bladder and/or pelvic pain.
As a patient with a UTI compared to an IC, the UTI, you don't want to go to the bathroom because you know it's going to hurt. It's going to burn or it's just going to hurt. With IC, you want to get to the bathroom because that's where your relief comes.
Terry Jo saw several physicians for her uncomfortable condition, but she couldn't get an accurate diagnosis or an effective treatment. So the 21-year-old professional athlete was left to manage this mysterious illness all on her own.
I was told I was just going to have to learn to live with it. You're an athlete, figure it out. You can learn to deal with this. So I wasn't given much hope. I was pretty much sent on my way to learn and figure out how to live with it. Little did I know I would be learning to live with this for the next almost 12 years.
And we're filling your bladder.
Because the symptoms of IC are similar to other painful pelvic conditions like urinary tract infection, an incorrect diagnosis can often occur.
That's the dome of the bladder up at top.
So seeking a pelvic pain specialist or urologist can be helpful.
Just like all diagnoses in medicine, the most important thing is a proper history and physical examination. The history of a patient with interstitial cystitis is very specific, and when you ask the right questions, you can really start to separate the different pelvic pain states that the patient might be suffering from, whether it's a bladder problem, vaginal problem, or a pelvic floor problem, or a combination of all three.
Patients living with IC respond to treatments differently. It may require a period of trial and error before the right treatment is found. Experts say diet is a good place to start. A nutrition plan low in acidic foods and drinks, and one that eliminates carbonated, caffeinated, and alcoholic beverages may be helpful in reducing IC symptoms. Terry Jo found the dietary plan she needed, and her life slowly returned to normal.
And so for the first time, I wasn't told just to learn to live with it. I was given a diet for IC, an IC diet. Let's try and eliminate these foods. I was given positive feedback.
But patients often need more than a new diet. They may also require medication. Current therapies can reduce urinary frequency, restore damaged bladder surfaces, and interrupt pain impulses. After years of struggling with IC, Terry Jo Myers has an overall treatment routine that works.
After about a year, I really stuck to the IC diet. And at about the year point, I would say I became a normal person. I could sleep through the night, and the turning point, the real turning point, is I could play 18 holes of golf without going to the bathroom. That's when I knew I made it.